Let's see how many you can get right.
Let's read question 1 together. A client with a history of hypertension is prescribed lisinopril. Which lab value should the nurse monitor most closely to prevent complications? We'll read the answer choices. You can make your guess, and then I'll show you the answer and talk through each answer option to explain how I answer it as a professional nursing tutor and someone who knows how to think like a nurse. A. Hemoglobin and hematocrit levels. B. Serum potassium levels. C. Blood glucose levels. D. Cholesterol levels. Pause if you would like to answer. I'm about to reveal it. The correct answer is B. Serum potassium levels. Let's talk through this. What do we need to know in order to answer this question? We need to know what drug class lisinopril is in. Even if you're not sure about lisinopril, the ending pril, P-R-I-L, indicates that it's probably an ACE inhibitor. ACE stands for angiotensin converting enzyme, which means this is a medication that inhibits or blocks that angiotensin converting enzyme. Now, if you've been studying with the Silver Bullet study system, which is the best way to study in nursing school, the next part should be a lot easier because your critical thinking will kick in and you'll realize that the angiotensin converting enzyme is a part of the RAS system. RAAS. That's the renin-angiotensin-aldosterone system. This is normal anatomy and physiology. And if you know what the RAS system normally does, and you know what's being changed with the ACE being inhibited, then we can easily predict any potential complications from taking this medication, even if you've never studied it before. That's the power of having studied with the Silver Bullet study system because you get used to thinking this way. Hemoglobin and hematocrit levels, this has nothing to do with the RAS system. It has to do with blood. Serum potassium levels. Potassium is partly controlled by aldosterone, which is the last step of the RAS system. Normally, aldosterone signals the kidneys to hold on to sodium, which causes the water to follow it, making the body retain water so that your blood pressure goes up. In exchange for the kidneys keeping the sodium, the kidneys will get rid of potassium.